Hello, everyone, welcome to my channel. I know precisely why you clicked on this video. The title, How Many Inches Every Woman Wants Based on Science, speaks to one of the most persistent and anxiety-ridden questions I hear in my practice as a urologist. Before we dive in, take a second to like this video, subscribe, and share it with anyone who could use a little reassurance backed by real science. Let's be honest, in movies, on social media, and in locker room conversations, men are bombarded with the message that bigger is better. This myth has become so deeply rooted that it causes unnecessary stress, leading countless men to feel inadequate. In my field, we even have a clinical term for this, penile dysmorphobia, a body image disorder in which a man perceives his normal anatomy as somehow lacking. Research shows that up to 45% of men express dissatisfaction with their size, even though most of them fall perfectly within normal biological ranges. This insecurity often starts early during adolescence, when exposure to unrealistic adult content creates a distorted idea of what's normal. The reality, the average adult film performer represents less than 2% of the male population when it comes to size. Yet those images become the mental baseline for millions of young men. My goal today is simple: to dismantle that myth, calm that anxiety, and share what science actually says, not fantasies or internet rumors, but peer-reviewed, clinically measured facts, establishing the real baseline before we can even talk about preferences. We need to start with the truth about averages, and that means disregarding the inflated numbers often seen in self-reported online surveys. These tend to exaggerate by 1.5 to 2 in a bias scientists call wishful measurement. The only reliable data comes from studies where medical professionals, urologists, or trained researchers perform the measurements themselves using standardized controlled methods. The bone press technique, for example, presses the ruler to the pubic bone to account for the surrounding fat pad, ensuring consistency. Measurements are taken in a warm clinical setting, with the subject standing at a 90 degrees angle from the top dorsal side. This precision matters because when studies follow these protocols, they consistently show the same results across multiple continents and ethnicities. A 2015 meta-analysis of more than 15,000 men found the average erect length to be between 5.1 and 5.5 in. A 2020 follow-up study with another 21,000 participants confirmed the same figures. The average girth circumference lands around 4.5 to 4.7 in. When flaccid, the range varies widely too, 8 to 3.9 in, because some men are growers who expand significantly when erect and others are showers who don't change much. Importantly, flaccid size has no correlation with erect size or sexual performance, yet it's often the source of locker room anxiety. Statistically, 95% of men measure between 4.5 and 7 in when erect, only about 2.5% exceed 6.9 in, and another 2.5% measure below 4.5 in. That means if you fall anywhere in that wide range, you are completely normal. This truth alone should lift a huge weight off your shoulders. The average man is far smaller than media portrayals lead you to believe. Those 9 or 10 in examples you see online, they're outliers, rare exceptions, not the norm. What women actually prefer, now to the part everyone's curious about. What do women really prefer? One of the most respected and creative studies on this was published in the journal PLOS ONE. Researchers didn't just ask women to imagine a size or pick a drawing. They used 3D printed penis models in various lengths and girths, all in a neutral blue color to prevent racial bias. The textures were realistic, mimicking real human tissue, and participants could actually handle them to judge size and feel. The study included 75 women ages 18 to 65, representing a broad mix of orientations and relationship backgrounds. The models ranged from 4 to 8, 5 in length and 2, 5 to 7 in girth, giving participants every possible option. Crucially, women were asked to choose ideal sizes for two situations: a one-time sexual partner and a long-term partner, like a husband or boyfriend. For a short-term fling, women preferred an average of 6, 4 in length and 5 in girth. That's only about an inch longer than the global average. Scientists suggest this slightly larger preference is driven by novelty or curiosity, an evolutionary thrill factor. However, for a long-term partner, the average preference actually dropped to about 6, 3 in length and 4, 8 in girth. This subtle decrease makes perfect sense for ongoing intimacy. Comfort and compatibility matter far more than size extremes. Overly large sizes can cause pain by hitting the cervix or overstretching the vaginal tissue, sometimes leading to microabrasions or conditions like vaginismus, where involuntary muscle tightening occurs to avoid discomfort. So, what's the takeaway? Women value a balanced, comfortable fit, not an extreme. What feels good repeatedly and safely is far more desirable than what merely looks impressive once. Why girth matters more than length? If you look closely at the data, you'll notice something fascinating. In these studies, girth preferences hover around 5 in, getting quite close to the ideal length of 6, 3 to 6, 4 in. That near equal ratio is revealing. When women are asked directly which matters more, length or width, the overwhelming majority choose girth. Anatomically, this makes perfect sense. The vagina is a potential space. It expands to accommodate what enters it with sensitive folds called rug that maintain sensation during stretch. The most sensitive areas, especially the outer third of the vaginal canal, respond more to pressure and fullness than to deep penetration. Additionally, the internal structure of the clitoris actually extends around the vaginal opening, meaning that wider girth applies more consistent pressure on these nerve-rich tissues. MRI scans of couples during intercourse show that girth provides greater contact with the anterior vaginal wall, where the so-called G-spot, technically the urethral sponge, is located. So once a man's length falls within the normal range, adding width has a much larger impact on sensation than adding length ever could. In other words, if you're focusing on what truly enhances pleasure, girth wins, what most women actually think. Perhaps the most comforting statistic comes from a huge international survey of over 50 participants. It found that 85% of women are satisfied with their partner's size. Among the 15% who weren't, dissatisfaction usually stemmed from issues like poor hygiene, lack of technique, or emotional disconnect, not from size itself. In the same survey, only 55% of men said they were satisfied with their own size. Men typically overestimate what women want by 20 to 30%. That gap between perception and reality fuels unnecessary anxiety. Another major study published in the Journal of Sexual Medicine found that men who watched pornography 3 or more times per week were 5 times more likely to be unhappy with their size, regardless of their actual measurements. In short, it's not your body that's the problem. It's the media illusion you're comparing it to. Yes, you can be too big. Here's a truth people rarely discuss. Size can become too much of a good thing. Penises over 8, 5 or 9 in often cause dyspareunia or painful intercourse for many women. The cervix, contrary to popular belief, isn't a pleasure center. It's highly sensitive to pain, and repeated contact can cause bruising, bleeding, and even cervical irritation known as ectropion. Similarly, excessive girth can lead to painful stretching, micro tears, or infections. Studies show that couples experiencing size-related discomfort often have less frequent or even avoidant intercourse. The biological design of the human body naturally favors moderation, a size that's stimulating but comfortable, pleasurable but not painful. What truly matters? Connection and technique. So if size isn't the defining factor, what is? Decades of research give a clear answer. Emotional connection, foreplay, and technique are what truly drive satisfaction. The Kinsey Institute and other global studies identify emotional intimacy, feelings of safety, trust, and affection as the single strongest predictor of sexual fulfillment. Women who feel emotionally close to their partners are 4 times more likely to report satisfying sex, regardless of size. Brain imaging supports this. When women feel secure, regions of the brain linked to pleasure light up, while areas tied to anxiety quiet down. The brain, not the genitals, is the most powerful sexual organ. Next is foreplay. Most women need 13 to 20 minutes of arousal to reach peak readiness, compared to just 3 to 5 minutes for men. Around 70 to 80% of women require clitoral stimulation to orgasm. Penetration alone rarely achieves it. The clitoris has more than 8,000 nerve endings, double that of the penis, most concentrated externally. Partners who prioritize this, who don't rush, and who treat foreplay as essential, not optional, create far more satisfying experiences. Studies show that lesbian couples, who typically spend more time on non-penetrative intimacy, report higher orgasm rates, 86%, than heterosexual women, 65%. That's not coincidence. That's communication and attentiveness at work. The third element is technique and effort. Being responsive, attentive, and present. Adjusting pressure, pace, and position based on your partner's feedback has far more impact than any physical measurement. Couples who openly communicate about preferences report 32% higher satisfaction overall. The real threat isn't size, it's anxiety. Ironically, the biggest barrier to sexual satisfaction isn't size at all. It's performance anxiety. Worrying about whether you measure up can increase cortisol, lower testosterone, and restrict blood flow, all of which hurt sexual performance. Confidence, communication, and care are infinitely more attractive than inches on a ruler. Science shows that satisfaction built on emotional and behavioral factors actually grows stronger over time, while satisfaction based purely on physical traits fades. If your anxiety about size has reached a point where it's affecting your self-esteem or relationships, please understand this is treatable. Cognitive behavioral therapy, CBT, has shown over 70% success in helping men overcome penile dysmorphobia. A trained urologist or sexual health therapist can help you retrain your perception and rebuild confidence. Remember, sexual health is part of overall health, and seeking help is a sign of strength, not weakness. If this video helped you see things a little clearer, give it a thumbs up, subscribe, and share it with anyone who needs a reality check grounded in science.